Hi, and welcome to the Ask Dr. Angela show with everyone's favorite OBGYN, Dr. Angela Jones. Have you ever been just too embarrassed or shy to ask your own doctor a question about your, private stuff? Well, you have come to the right place to get straight answers. Feel free to ask Dr. Angela anything women's health related. OBGYN, she keeps it real. Pregnancy, she knows what you're expecting. Whole body health, just ask. Dr. Angela has you covered, girl. And now here is Dr. Angela.
What's good, people? This is Dr. Angela, everyone's self-proclaimed favorite OBGYN, and I would like to officially welcome you to episode 38 of the Ask Dr. Angela podcast. I have had so much going on. I am in the final editing stages of my book. I don't know if I mentioned this to you all, but I'm in the process of completing a pregnancy book, and I am just over the moon with excitement about it, because it basically addresses everything that I talk about on a day-to-day basis. And it basically addresses every question that all of my pregnant moms have ever wanted to know. And how do I know that? Because I'm answering these questions every day. So I've put it into a very light, humorous, easy to understand book, and I'm so excited to get this out to the public because you're really going to enjoy reading it. I think that people who are not even pregnant will enjoy reading it. I'm reading it and I'm still laughing. Granted, I laugh at myself by myself all the time. So anyway, let's jump right into today's topic on colposcopy and what to expect. This is a little bit of a carryover from episode 37 when I talked about what you need to know about HPV. And basically, if you're coming to an office or my office specifically for a colposcopy, it's likely because you've had an abnormal pap smear. And it doesn't even really matter what the abnormality is. I mean, it can be atypical cells with high-risk HPV, a low-grade lesion, a high-grade lesion. Fact of the matter is, you had a pap smear that was abnormal that requires a little bit more investigating. And that's really how I explain colpos or colposcopies to my patients. It just means that I need to take a little bit of a closer look to ensure that there is nothing more significant going on with your cervix. So again, really the purpose of the colposcopy is to ensure that the pathology that we obtained from your original pap and the findings that we obtain when we do your colposcopy are congruent, because what we don't want is for the colpo to show something more significant, which would require further action. Okay, so what the hell is a colposcopy? Basically, what it involves is you come into the office. The setup for the exam is pretty much like a normal pap smear. You get into those god-awful stirrups. We put that god-awful speculum in so that we can adequately view the cervix. The next step is coating your cervix with a vinegar-like solution. Yes, I did say vinegar, so it's going to kind of smell like Easter eggs. You're like, really? I know. Other than it being a little bit cold, that's all you're going to feel. So I typically let that sit up for a couple of minutes, and then I take my colposcope, which is that really odd-looking machine that you're going to see in the room, and it basically looks like binoculars on a stick. And what the colposcope allows me to do is to look at your cervix under much higher magnification. The purpose of the acetic acid is that it will help to highlight any areas of concern on your pap smear. And I don't really want to go into all of the technical things that I may be looking for, whether it's acetowhite epithelium, mosaicism, punctation, any obvious lesions. And I just told you that I didn't want to really go into any of the things that I'm looking for. Oh, I guess I lied on that one, right? But anyway, the colpo allows me to take a much closer look at your cervix. And certainly if I see anything that raises my eyebrows, i.e. what I just mentioned, it may require taking a biopsy. Now, don't freak out. I know you're thinking, oh my gosh, she's going to take a biopsy. It's like a big chunk of my cervix. That is so not true. The biopsy basically is literally just scraping some cells off of the surface of your cervix. I mean, the tissue sample that's obtained is so small. The other piece of the colpo that I typically do, unless you are pregnant, even if I don't do a biopsy, is something called an ECC, and that stands for endocervical curette or curettage. And the reason for that is that when we do your colposcopy, your cervix basically looks like a donut. It's like looking at a round cake donut. You can see the outside, but you can't exactly see down into the tunnel. So the purpose of the ECC is to aggressively sample those cells down inside the lining of the cervix so that we can make sure that there's no lesion that's actually extending inside the cervical canal. I typically warn patients that that piece of the exam can be a little bit crampy. So if you're going to want to kick me in the chops, that's probably the piece where you are going to want to do it, or the place where you're going to want to do it. Again, we do not do ECCs during pregnancy. It usually takes about a week or so for us to get the Colpo results back. And again, what we're looking for is just to make sure that there's not a more significant lesion that we find on colposcopy when we compare it to the lesion that we found on your pap smear. We want them to be congruent. Similar in findings and not more significant, i.e. we don't want the colpo to be more significant. As long as we're dealing with something that's low grade and less, it's typically something that can be managed conservatively, i.e. you get to see your OBGYN a little bit more frequently. Usually that means a pap smear every 4 to 6 months over the course of the next year. The other thing that I always encourage my patients to do that have abnormal pap smears, specifically those that are complicated by HPV, and we know that even for low-grade lesions, 80% of them have an association with high-risk HPV. I typically recommend that my patients start taking a multivitamin if they are not already doing so. The zinc component is a very strong antioxidant, and there is some literature that supports that it helps to eliminate HPV. Most people really freak out when they find out that they have to have a colposcopy. Like, oh my gosh, I have cancer. That's not what a colposcopy is saying, folks. So don't freak out if your doctor tells you that you have to come in for further testing or, further evaluation due to an abnormality in your pap smear. That's all a colpo is. And last but not least, I always encourage my patients, please do not get lost to follow up. If you have a colpo and we tell you to come back in 6 months, come back in 6 months. If we tell you to come back in 4 months, come back in 4 months. The one thing about cervical cancer is that it typically does not just appear overnight. In all of the cases of cervical cancer that I have personally diagnosed, the one thing that all of those women, or most of those women, had in common is that they hadn't had a pap smear in like years. So I hope this has provided a little bit of insight into what to expect if you happen to have to go in for a colposcopy. I know that that can be a pretty scary occurrence for some people, and most of it is just we're nervous and you don't really know what to expect. So hopefully this will help to alleviate some of those concerns or fears. Thank you so much for tuning in to the Ask Dr. Angela podcast. I certainly appreciate all of you. If you have a question, a thought, an idea that you would like featured in the Ask Dr. Angela podcast, please go to www.askdrangela.com. That's ASKDRANGELA.com. Click on the microphone on the right-hand side of the page and do what you do. If we do happen to feature your question or your thought on the podcast, someone from my team will reach out to you and send you one of our bomb-ass t-shirts. Look for those on either my Twitter account or on my Facebook page. The new t-shirts are actually really very nice. In closing, I would like to leave you with this thought from Eli Kameroff. The best things in life are unexpected because there were no expectations. Think about that. Until next time, look better, feel better, be better. I cannot wait to reconnect with you on episode 39 of the Ask Dr. Angela podcast.
Thank you for listening to the Ask Dr. Angela podcast. For more information on women's health and the show notes for this episode, please visit Dr. Angela at www.askdrangela.com. While you're there, don't forget to leave your own message for Dr. Angela. See you soon. All of the information provided and discussed in this podcast is for educational and informational purposes only and should not take the place of consulting a physician. This podcast is not intended to diagnose, treat, or cure any diseases or illnesses and does not and should not replace treatment for a medical professional. Listening to and participating in this podcast does not create a doctor-patient relationship between you and Dr. Angela Jones. If you need medical advice or assistance, you should consult a physician. Listening to and participating in this podcast is subject to the terms and conditions posted at drangela.com/terms.